Hi, I'm Linda Tuttle. I'm sure that there's some of you that know me, but there may be several of you that don't. Most of my life I've spent being a nurse. It was a large part of my life. I worked at Samaritan Hospital for years. I've done several different things. I've taught nursing program, worked with cardiologists, and just loved all kinds of nursing. Never really been sick and hadn't ever thought about being the patient, just the nurse. It was back December 5th of 2009. I woke up in the middle of the night with terrible chest pain. I kind of a high-strung person, so I thought I was having a panic attack. And I called my doctor just to be sure, because it didn't go away after 2 or 3 hours, and came into this ER and they did a lot of testing. My heart was fine, but they found that my pancreatic enzymes were very high, and later that my liver enzymes were very high. So that showed them that there was something going on in there that wasn't very good. So the doctors sent me to Columbia to a gastroenterologist. They did a procedure and found that there was a disease process in the lower part of my stomach. The biopsies come back that it was a tumor, but it wasn't a cancerous tumor. The doctor in Columbia referred me to a specialist in St. Louis who can do surgeries without opening you up. Goes down with a scope into your stomach and can take out the tumor. So they did that. Well, unfortunately, that tumor kept growing back every 2 or 3 months, till by the end of that year, in December of 2009, when the biopsies come back after they had done the procedure, the biopsy came back cancer. It was in the lowest part of my stomach, called the duodenum. They decided the best thing to do was to do a surgery called a Whipple. I won't go into detail about that. It's just a very dangerous, very long operation that involves your liver and your pancreas and your stomach. They removed everything that touched the cancer and anything that might need its blood supply. After that, I was in the hospital then for about 3 weeks. It took me a long time just to convalesce from that, but shortly I found out that I wasn't going to be able to be the nurse that I'd once been, that this was a surgery that you really don't jump back from or come out of very easily. So I had a lot of failure to thrive through that and spent a lot of time ill. It got to where I couldn't eat regular food at all. So they operated and they put a feeding tube in my side. And that didn't work. It would go into my stomach, but then it would come right back out. So they put a port in my chest and they fed me for about 1.5 years with IVs through this port. Well, finally, that got to where they had to stop that because of risks of infection. I had developed a terrible infection in the port I had first had. So they took that out, and the main concern was the pain that I was going through. Terrible amounts of pain in my stomach, right under my breast and across to right in your, what they call the epigastric area, kind of where you hold when you need to belch. That would just have terrible pain that went all the way through to my back. So we had to find some way for me to eat, and the Lord works in mysterious ways. My husband came up with a concoction of, there's Ensure and all those different kinds of foods that you can drink. He found that Atkins had a brand that had more of everything in it, the protein and stuff, and I couldn't drink them and keep them down. So he mixed it with ice cream that was sugar-free, fat-free, and refroze it in little cups, and I could eat that. So that's been my diet for several years now, and with a different Visalis shake using that here and there. I've just basically been on a liquid diet. The worst things are the chronic pain has just gotten worse and worse. During the worst of it, I lost 60 pounds and just became an invalid status, couldn't get up and around. I'm doing better, and that I can get up and walk around, but I can't drive a car. I can't live what you would call a normal life. But I have a wonderful, wonderful family, and just a ton of wonderful friends. The hard part comes into where after you've gone through a chronic disease like this, after so long, you lose all your assets. We lost our insurance the second year into it and went for a year and a half with no insurance at all. And we had planned very well for retirement. And my husband had already just retired before I got sick. And so we thought we were putting all that money away for our retirement, when actually the whole time God knew we were putting it away because we were going to need it. And so we were lucky to have the money when we needed it. As years go by, though, the money fast slips through your hands for this medicine or that. Medicines are very, very high. I'm to the point now where I'm in the hospital for pancreatitis about every 6 weeks. I'll have to go in and stay in the hospital for about a week. My pancreas that's left, they took half of it during the Whipple surgery. And then they took some more of it a couple years later. They had to revise the Whipple surgery and take more because the cancer grew again. It's a very slow growing cancer, but it sure knows how to get to keep going and keep growing. So we finally got to a point where we could get Medicare, and that was wonderful. We finally got to where we could get Medicaid, and that was a blessing. And then we got Medicare. You have to wait so long, as some of you may know. I didn't know anything about Medicare or Medicaid or anything when I started this. I was just a nurse. I didn't know what the patients went through. I had one lady in a hospital in Columbia tell me, all that money you saved for a rainy day, well, today it's raining. And that's the way to look at it. You know, you just have to take your assets and use them as God has planned. Well, now I'm on the Medicare and I have a secondary, but I still have to pay quite a bit for my oral medications, and there's a shot for the cancer that I take once a month that's several $1,000s, and that's very expensive. Now they do pay their part, but my part of it is still quite high. The enzymes I have to take, the Creon enzymes, to replace the enzymes that my pancreas doesn't put out, costs about $1,200 a month. Some of my medications for nausea cost $300 to $500 a month. The pharmacies have been wonderful to help work with us and sell us small amounts at a time and so forth, but it just gets to a point where you need to reach out to your community and to your friends and to your church, or just anybody that's interested in helping someone, and realizing that at some point in their life they may need help as well. You never think it's going to happen to you. I was 49 years old when it started, and I was working 12-hour shifts and running, Mach 5 with my hair on fire. I had 2 or 3 different jobs, and now I have to be driven to the doctor's office and so forth, but it's really been easy to keep my spirits up through it because I have a wonderful family. My grandchildren are my everything, and God has taught me his many promises. He promised us that in our lives, he didn't promise us that it wouldn't hurt. He never promised that we wouldn't have trials or tribulations. He never promised that it would be easy. But he always promised that he would be there to hold us and to take care of us. And so every time I have a need, God is there to help me, sometimes through people like yourself. After I had the Whipple, the biopsies came back worse than what we'd expected. The surgeon came in and told my family and I that I had a life expectancy of probably 5 years, because the carcinoid tumor had grown up higher into my stomach and was in my lymph nodes. And then as things had continued to decline and having to go through the second surgery, several times I've had physicians give me limitations on how long I'll be living, and I don't pay attention to that. Not that I don't respect the doctors. I just am a Christian, and I feel that God knows what He's doing, and there's a reason why I've gone through this, and He will take me home when it's His time. So that's, I think, a really positive thing that I've been able to do for myself with His help, because worrying is the worst thing you can do. So God, really, I do lean on Him a lot, and my family leans on Him a lot, and my friends. So when you see this, I hope that you have great health and that you have put aside money for your retirement, or for if something happens someday that you just don't expect. And I just hope that you can see in your heart to reach out and help others as God tells you to do. It may not be me. It may be somebody else that you know that has cancer, or any other of the millions of diseases that are now in this world that we have no cure for. I'm planning on going back to St. Louis. They're doing more and more procedures with the pancreas where they're able to remove the dead tissue and do different things. So I'm praying that there is a procedure that they can do. A year ago when I went, they told me there wasn't anything else they could do for me. And so I've just been living it a day at a time. But I will be going back. I won't ever give up. As my t-shirt says, when I write this book, at the end of it, it will never say that I gave up. I believe in hope and happiness.